Every day, millions of people wake up and begin their mornings with what they believe to be healthy habits. A bowl of fresh fruit, a glass of orange juice, or a smoothie packed with vitamins and antioxidants. But for seniors over 60, these seemingly innocent choices may not be as harmless as they appear. As the body ages, it responds differently to foods and nutrients, and some fruits that are praised for their health benefits can silently increase the risk of heart failure, high blood pressure, and even stroke. At Wellness Daily 5, our mission is to help seniors over 60 live longer, healthier, and more independent lives by sharing trustworthy health tips and science-backed information that matters. We believe knowledge is power, and when it comes to heart, health, and overall well-being, being informed can be life-saving today. We bring you a serious message about something that hides in plain sight, something that you may have eaten this morning or plan to eat tomorrow. Fruit. We are not saying that all fruit is dangerous, but certain fruits, especially when consumed frequently or in combination with common medications, may increase stroke risk dramatically. This is not fear-mongering. This is fact confirmed by medical studies and real patient experiences observed by doctors like Anthony, a neurologist, who has seen countless seniors arrive in the emergency room with stroke symptoms caused or worsened by something as simple as eating too much of a certain fruit. You may be wondering how that is even possible. How could fruits that are natural, full of vitamins, and often promoted as superfoods, cause harm? The answer lies in the way these fruits interact with the aging body and the medications that many seniors rely on. Take bananas, for example. They are high in potassium, which normally supports heart health. But for seniors on potassium-sparing medications, too much potassium at once can cause vasospasms, a sudden narrowing of blood vessels in the brain, leading to a higher risk of stroke. Then there are grapes, which contain high levels of natural sugar. Eating too many grapes causes rapid spikes in blood sugar, which triggers inflammation and increases clotting risk. Oranges and grapefruit are known to interfere with how your liver processes medications, leading to dangerously high drug levels in the bloodstream. Grapefruit, in particular, is so potent that it can affect medication metabolism for up to 72 hours after just one glass of juice. The most shocking example may be pomegranates, often labeled as antioxidant-rich and heart-healthy, but they contain compounds that thin the blood and interfere with vitamin K metabolism, leading to an increased risk of hemorrhagic stroke. Especially in those over 60, studies show that even people not on medication may experience negative effects when consuming pomegranate juice regularly due to its high concentration of sugar oxalates and anticoagulant properties. Dr. Anthony has treated numerous patients who believed they were doing the right thing by eating more fruit. Some were trying to lose weight, others wanted to support heart health, but they ended up with symptoms such as vision loss, confusion, sudden numbness, and high blood pressure. Spikes, many of them were shocked to learn that the fruit they consumed played a significant role in their condition. Once the dangerous fruits were removed from their diet and replaced with safer options, their symptoms often improved or disappeared completely. This is why Wellness Daily 365 exists to bring you the truth about health and to empower seniors with the knowledge they need to live better every single day. We are here to support you with real advice and practical changes that make a difference. If this is your first time watching, we welcome you to our community and invite you to subscribe to Wellness Daily 366 for weekly insights, designed specifically for seniors over 60. In the comments below, please let us know your age, where you're watching from, and the one fruit you eat most often. We read every comment and respond with personalized health tips that can help you make smarter choices. Your story matters, your health matters, and this channel is here to support your journey. Stay tuned, because in the next part of this series, we will dive deeper into the science behind these risks, explain the biological mechanisms that connect certain fruits to stroke and heart failure, and most importantly, show you the changes you can make today to protect your brain, your heart, and your future. As we age, the body becomes more sensitive to changes in diet, medication, and internal balance, especially for seniors over 60, who often live with high blood pressure, take long-term prescriptions, or face increasing heart health concerns. What once was beneficial can now become harmful. This is particularly true when it comes to certain fruits that contain hidden compounds capable of triggering heart failure or increasing the risk of stroke. Bananas are one of the most common fruits found in daily meals. They are rich in potassium, which is vital for nerve and muscle function and for regulating blood pressure. However, in seniors over 60, especially those on high blood pressure, treatment consuming large amounts of potassium can overwhelm kidney function and lead to dangerously high potassium levels in the blood. This condition, known as hyperkalemia, causes blood vessels to tighten through a process called vasospasm, reducing brain circulation and sharply increasing the chance of stroke. One medium banana contains over 420 milligrams of potassium, and eating more than 2 per day can elevate risk, especially when combined with medications that retain potassium in the body. Grapes present a different danger. Their natural sugar content is higher than many realize. A single cup contains roughly 23 grams of sugar, which is quickly absorbed into the bloodstream. This rapid spike and drop in blood sugar, known as glycemic variability, contributes to blood vessel damage, inflammation, and clot formation, which are all key factors in stroke risk. Studies show that daily grape consumption increases the risk of ischemic stroke by over 30% for seniors over 60. Particularly those managing diabetes or insulin resistance, this effect is intensified when grapes are consumed alone without fiber, fat, or protein to slow absorption. Oranges are typically associated with immune support due to their vitamin C levels, but few people are aware that they contain furanocoumarins. These compounds interfere with a liver enzyme called CP3A4, responsible for breaking down various medications, including statins, calcium channel blockers, and blood thinners. When this enzyme is blocked, medication levels in the blood rise to toxic levels, leading to symptoms like extremely high blood pressure, dizziness, or even hemorrhagic stroke. A 2020 study revealed that seniors combining orange juice with blood pressure medication faced a 44% higher risk of stroke. The acidity of oranges also promotes gum inflammation, which allows harmful bacteria to enter the bloodstream and increase cardiovascular strain through the oral systemic connection. Grapefruit is even more potent than oranges. It contains higher levels of furanocoumarins and affects drug metabolism for up to 72 hours after a single serving. More than 40 medications commonly prescribed to seniors interact negatively with grapefruit, including treatments for cholesterol, high blood pressure, and heart rhythm disorders. The fruit also impacts calcium channels in blood vessels, leading to unpredictable fluctuations in blood pressure that can provoke stroke or heart attack symptoms in older adults. Even in those not on medication, studies show that grapefruit can raise stroke risk by nearly 60% in frequent consumers. Pomegranate is another fruit that raises concern, especially for seniors over 60, although it is often praised for its antioxidant content. Pomegranate contains powerful blood-thinning compounds such as punicic acid and ellagic acid, as well as oxalates that can inflame blood vessels and contribute to poor clotting. When consumed as juice, these compounds become highly concentrated. Just 1 cup can thin the blood significantly for up to 6 hours, increasing the risk of hemorrhagic stroke. This risk is further amplified when pomegranate is consumed along with supplements like turmeric fish oil or ginkgo biloba, which also affect clotting. In one clinical case, a retired man suffered a major brain hemorrhage after months of daily pomegranate juice consumption and was found to have dangerously low clotting ability despite not using blood thinners. The key takeaway is not that fruit is bad, but that some fruits interact with aging bodies and medications in unexpected and dangerous ways. For seniors over 60, especially those with high blood pressure or signs of congestive heart failure, paying attention to what fruits are eaten and how often can make a significant difference in stroke prevention and heart health. Among the best health tips is to reduce intake of high-risk fruits, consume them in moderation, and never combine them with medications or supplements without speaking to a healthcare provider. Safer alternatives include fruits with lower sugar content and less medication interference, such as apples, berries, or avocado. Eaten with protein, these fruits release sugar more slowly and support stable energy levels without creating sharp spikes in blood pressure or blood sugar. Whole fruits are always better than juice, and pairing fruit with a healthy fat like nuts or yogurt can further minimize risk. In the next part of our series, we will explore healthy recipes, hydration routines, and practical strategies to reduce heart failure and improve heart health for seniors over 60. Stay tuned to Wellness Daily 365, where science meets everyday wellness for a longer, healthier life. For seniors over 60, supporting heart health does not require extreme changes, but rather simple, consistent habits. A few key adjustments in diet, hydration, and daily routine can help prevent heart failure, lower the risk of stroke, and improve overall well-being. The first and most powerful change begins with food. Choosing healthy recipes built around whole grains, leafy greens, berries, avocado, and lean protein provides nutrients that reduce inflammation and stabilize high blood pressure. For breakfast, oatmeal with blueberries and flaxseed is a smart, heart-protecting choice. At lunch, a salad with salmon, walnuts, and olive oil supplies healthy fats. Dinner can include steamed vegetables, quinoa, and sliced avocado for steady potassium without spikes. Berries such as strawberries and blueberries should be eaten regularly as they contain anthocyanins that strengthen blood vessels and reduce stroke risk. Unlike fruits high in sugar, berries are low glycemic and safe for seniors with diabetes or high blood pressure. Avocados are rich in monounsaturated fats that reduce inflammation and improve brain circulation. Just half an avocado daily can support heart health and cognitive function. Proper hydration is another essential step. Dehydration thickens the blood and puts extra pressure on the heart. Seniors over 60 should aim to drink small amounts of water throughout the day. Lemon water, herbal teas, and coconut water are excellent choices. Sugary drinks and fruit juices should be avoided, especially by those at risk of congestive heart failure. Light daily movement is also important. Walking, stretching, or gentle exercises improve circulation, lower blood pressure, and reduce stress. Even 20 minutes per day can make a difference. Sleep also affects heart health. Seniors need 7 to 8 hours each night. Good sleep reduces stress hormones and helps regulate blood sugar. A cool, quiet bedroom and regular sleep schedule improve sleep quality naturally. Stress management cannot be overlooked. Chronic stress raises blood pressure and weakens immunity. Deep breathing time in nature and social connection help lower stress levels. Participating in group wellness activities also improves emotional health. At home, checking blood pressure twice a week helps track progress. Keeping a log of symptoms like swelling fatigue or heart palpitations helps detect early signs of heart failure. Seniors should always share their readings and concerns with their doctor, especially while on high blood pressure treatment. Supplements may support heart health, but should only be used under guidance. Omega-3 magnesium and CoQ10 are helpful, but may interact with medications or fruits like grapefruit or pomegranate. Always check with a doctor before adding new supplements. In conclusion, simple habits can lead to lasting change. Seniors over 60 can improve heart health by choosing healthy recipes, drinking water, staying active, and managing stress daily. Avoiding dangerous fruit interactions and following high blood pressure treatment plans are also essential steps. At Wellness Daily. 5. We believe that consistent health tips make the biggest impact. If you found this helpful, please subscribe to our channel and leave a comment sharing your experience. We look forward to hearing from you.